flat on your back all you want, and the patient will still lie on their stomach. I need you to on your other back. Alright, so I'm gonna pop that light off. Alright, so she's on the table. The other thing too, since we are using the buggy, I'm going to actually start with, let's start with, we'll start with knee. We'll start with knee. Grab some calipers. So these are your calipers here, okay? So this one, with these you're gonna go by where the little points are, okay? Where they hit. These little points right here, okay? So, I'm gonna find her ACES right here. ACES is right here. So, bring this up, slide right in, because I want this to come down right on her ACES, right there. So I'm gonna come down, and she is right barely above 19, so she's between the 19 to 24, so that's perpendicular, okay? So, she's normal. So, okay, so I'm gonna go ahead, grab my 10 by 12, line up my arrows, push it all the way in, make sure it's anchored, and then lock it, okay? I'm just gonna go ahead and do this real quick.
We need any kind of shielding for it?
Do what?
We need a shield for it?
Yep. The only one we're not shielding for is pelvis. Everything else we're gonna shield as much as we can. So I'm gonna go ahead and open to my 12, 10, I'm gonna do this one, 4. Okay. So our patella is right here. So I usually put my finger tip at the patella and I end up right behind it. Right below, because remember, only a 1/2 inch distal. Okay, usually hits right on it. So her patella, okay, usually right below there. Okay, so I need to rotate her knee, her foot just a little to get it in the center. Okay, so from here, and yes, this is in. I think the markers are back over here. I have markers. All right, so this would be her right canine. We'll pop that right here. Okay.
Is it canine? The column?
That's a canine. That's a canine. So and I can call. Oh, no, not beyond. Call me a little side to side, not much. So again, I want to make sure that I'm nice and straight. So I'm actually going to straighten up just a smidge. So she's a little off center. That would be for our AP knee, okay? So now I need to make sure that's lined up. Okay. All right, so now that we're lined up here, it's our AP knee. Again, this one just holds still. There's no breathing instructions for femur and knee. Hip and pelvis are the only ones that have breathing instructions, okay? So from here, I am gonna go ahead and let her do her medial rotation first. So I'm gonna have her rotate her entire leg, not just the lower. You're gonna rotate the entire leg, okay? So she's right where she needs to be, that 45 degrees. So I'm gonna take this, and I'm gonna come back. Still need to be centered of the knee. I'm still 1/2 inch below the apex. Her apex is here. I'm still at 1/2 inch below. Pop this in, and again, I don't want this in the shadow. Make sure this is not in the shadow, because you're gonna get dinged for it. I can have it as close to it as I want, but this is what I'm looking for, okay? So this will be for your medial rotation, okay? So actually, let's slide you just a smidge. There we go, okay. Again, long axis of what's being imaged, okay? That would be for your, and again, you should not have to move this and this, okay? float the patient. Okay? Yeah, once it's set, leave it alone. Don't touch it. For at least for the first 3 projections. Okay. All right, so from here, it's like, all right, what I'm gonna get you to do is just let your foot fall to the side for me, just like that. Average person does this. You are gonna have that patient who wants to do this. No. It's like, I just need you right here. Just a normal. So I'm gonna slide this over to center everything up. Pop this in here again. And this is the one where part of your fibula ends up superimposed into the tibia itself. Okay? I'm actually gonna float just a smidge. Down just a touch. Okay. That will be for your lateral rotation or external rotation of your knee. Okay? Remember, internal rotation, fibular head is free of superimposition. And they do like to ask questions like that too. Okay. And we're used to seeing wiggle worms. It's all good. So, all right. The other reason I go ahead and do this is because her foot's already starting to rotate out. So, all right. So I gotta get a side view of your knee. So what I'm gonna get you to do is, can I get you to rotate up onto this hip here? Okay. So. Get her to flex her knee some. And here, just gonna go ahead and automatically angle 5 degrees. Okay, I'm gonna come down. Because either way, I'm still gonna have to move this because I put the angle on it. So this one here, I'm literally going, so I find her condyles, and you can feel them very prominent right here, okay? I can find them. So here, come forward just a little. Now you're superimposed, okay. So you want to make sure, so you can either use their hip like that if you'd like. I'm going to show you 2 different ways to do your lateral knee. Want it straight through the joint space. Remember, condyles are here, and most patients you can hit right about the crease, and that's that inch below that you need. Most patients, once they bend it, that crease can be kind of a fail-safe for you. You want to make sure you have a little bit of light behind the knee in the bend. Okay, so I still need to make sure I'm centered on her knee, front to back, and that's what I'm looking for. Okay, line this up here. Okay, that will be for your lateral knee. Gotta make sure when you're feeling, you'll get to a point that you can do this, and you'll be able to tell if your fingers are, come forward just a little bit more, Heather. You can actually feel when your fingers line up. Whether they're like this or like this. You'll be able to feel the difference, okay? All right. Actually, when I rotated you, I moved it. There we go. All right, okay. So this is one way to do your lateral knee. The other one, if your patient cannot hold this, bring this leg over. You have patients who can hold this a little bit better, but you gotta watch this foot when you do this. So if I needed to, because I can put my hand here on her hip, and if I need to, I can rotate her using, if I need to rotate her forward or back, okay? So again, hands here, so I've got her too far forward. I'm gonna bring you back, right? There we go. Okay, so I need to slide her back some. That's that way, but you have to watch this because the patient will do this last minute, okay? That's one way to do it, okay? That will be for your knee. That's the forward projection of the knee. Knee's pretty straightforward, okay? So the sunrise view, I'm gonna show y'all really quickly. Actually, I'm gonna show that to y'all at the end because it's not part of checkoff, okay?